Right now, millions of Americans are already struggling with higher rent, higher groceries, and higher medical bills. And now, your ability to drive and your independence could be next. If you or someone in your family is over 65, this video could affect your freedom, your job, your doctor visits, and even your bank account. Let's be real for a moment. For many seniors, driving is not a luxury, it's survival. It's how you get to work part-time, how you pick up prescriptions, how you care for your spouse, how you stay connected to the world. And when rules change at the DMV, it's not just paperwork. It's stress, it's costs, and it's fear of losing independence. And here's what makes this worse. Most people haven't even heard about what's coming yet. The notices are buried in fine print, website updates, and local announcements that most people never see. But the consequences? Very real, very fast, and very expensive if you miss a deadline. So today, we're breaking down the three major driving rule changes that are rolling out for drivers over 65, what they really mean for your daily life, and what you must do right now to protect your license, your freedom, and your wallet. And trust me, the third change is the one nobody is ready for. So don't go anywhere. Why DMVs are changing rules. Now, DMVs across the country say they're making these changes for public safety. But for seniors, it feels like the rules are suddenly moving faster than ever. Here's what's happening behind the scenes. States are facing growing numbers of older drivers, longer lifespans, and more crowded roads. At the same time, accident data, insurance claims, and healthcare costs are all under pressure. So, what do governments do when budgets get tight and liability goes up? They tighten the rules. But here's the problem. These changes are not happening evenly. One state updates rules quietly, another follows. Then insurance companies start reacting, and before people even realize what's happening, they're being told they need new tests, new documents, or new appointments just to keep driving. And for seniors, that can mean extra fees, long waits at the DMV, expensive medical exams, and sometimes sudden license restrictions. This isn't just about safety anymore, it's about access. It's about whether you can legally drive to work, to your doctor, or to take care of family. And when you combine that with inflation, rising healthcare costs, and shrinking retirement savings, every new requirement feels like another financial punch to the gut. So now let's talk about change number one, because this is where most drivers over 65 are going to feel it first. More frequent license renewals. In many states, drivers over 65 are now being required to renew their licenses more often than younger drivers. Instead of renewing every 8 or 10 years, some seniors are now facing renewal cycles of every 2 to 4 years. That may not sound terrible at first, until you think about what renewal really means. It means taking time off, it means transportation if you can't drive there, it means waiting in long DMV lines or booking appointments weeks in advance, and in some cases, it means extra fees each time. For seniors on fixed incomes, even small fees add up fast. And if you miss a renewal window, that's when things get scary. Late penalties, license suspensions, or being forced to retest. Now here's the part that really upsets families. Many seniors don't even realize their renewal period has changed until they get pulled over or receive a warning letter. And by then, the stress is already real. Mini summary so far. More renewals, more appointments, more chances to lose driving privileges if you miss a step. But that's only the beginning, because rule change number 2 goes even deeper into your personal health. Medical and vision check requirements. More states are now requiring additional vision tests, medical forms, or doctor sign-offs for older drivers. This is where things start to feel personal and expensive. In many cases, seniors must now submit proof from a doctor that they are medically fit to drive. That means appointments. That means copays. And if you don't have easy access to a physician, that becomes another barrier. Vision tests are also becoming more frequent, and in some states, they are no longer optional for seniors. Fail the test, even slightly, and your license may be restricted to daylight driving, local travel only, or in worse cases, suspended until further testing. Now think about what that means for daily life. Can't drive at night? No evening shifts. Local only? No highway trips to see family. Temporary suspension? Suddenly you're relying on rides or paying for transportation. And here's what really worries advocates. Some seniors are giving up their licenses voluntarily because the process feels overwhelming. Not because they're unsafe, but because the system is too hard to navigate. And when driving stops, isolation increases, health declines, and costs go up. But wait, because the third rule change could affect you even if you pass every test. Reporting and automatic reviews. In several states, doctors, family members, and even law enforcement can now trigger automatic DMV reviews of senior drivers. This is the change nobody expects, and the one that can happen without warning. If a doctor notes certain conditions, they may be required to notify the DMV. If a family member raises concerns, that can trigger an investigation. Even a single traffic stop can sometimes start a medical review process. Once that happens, the DMV can demand new tests, new medical reports, or even suspend your license while the review is happening. And here's the scary part. You may not get much time to respond. For seniors who rely on driving for daily survival, this can feel like losing control overnight. Now, let's be clear. Safety matters. Nobody wants dangerous drivers on the road. But what's frustrating many families is how fast the process can move and how slow the appeals can be. You can lose your license quickly, but getting it back can take months. And during that time, life doesn't pause. Bills still come, appointments still matter, family still needs support. This is why people are calling this a quiet crisis for aging Americans. And now that you know the three major changes, let's talk about what this actually means for your finances, how this hits your wallet when driving becomes harder, life becomes more expensive, fast. Let's walk through this realistically. If you can't drive, you may need rideshare services, paid transportation for medical visits, delivery fees for groceries and prescriptions, help from family who may miss work. All of that costs money. And for seniors on Social Security or retirement savings, there's no extra income waiting to cover these new expenses. Then add medical costs for required exams, add DMV fees for repeated renewals, add possible insurance changes if your license status shifts. Suddenly, what looked like just paperwork turns into hundreds or even thousands of dollars per year. And here's something people don't talk about enough. Insurance companies also pay attention to license restrictions and DMV records. That can affect premiums, coverage options, and even eligibility. So yes, driving rules are now directly connected to your monthly budget. And when people already feel squeezed by inflation and healthcare, this feels like one more system making life harder, not easier. But here's where things take a turn, because most people think this only affects people already having problems. That's not true. Who this really affects. Even if you feel healthy, alert, and confident behind the wheel, these changes can still affect you. This is the part that surprises people. You don't need to be in an accident. You don't need to fail a test. You don't need to be unsafe. All it takes is a routine doctor visit, a concerned relative, or a simple renewal notice with new requirements. And suddenly, you're in the system. Many seniors say they were shocked by how quickly their status changed from normal driver to under review. And once that process starts, the burden is on you to prove you're fit to drive, not the other way around. That can feel unfair. It can feel stressful. And for many people, it feels humiliating. So if you're watching this thinking, this won't affect me, please understand. That's exactly what thousands of people thought before they got the letter. Which brings us to the most important part of this video. What you can do right now to protect yourself. What you should do right now. Very important. The worst thing you can do is wait until you get a notice. By then, your options may already be limited. Here are smart steps you can take now. Check your state's DMV website for senior renewal rules. Confirm your next renewal date. Don't assume it's the same as before. Ask your doctor about any conditions that could trigger reporting. Keep copies of medical records related to driving ability. Make sure your vision prescription is current. Also, talk to your family, not in fear, but in planning. If transportation becomes an issue, it's better to discuss options now instead of during a crisis. And if you've recently received any DMV mail, do not ignore it. Even small notices can turn into major problems if deadlines pass. This is about staying ahead of the system, not fighting it later. Because once a review or suspension starts, the process gets longer, harder, and more stressful. And unfortunately, that stress can affect health, which only makes things worse. Now let's talk about something people rarely discuss: the emotional impact of all this. If you ignore this, here's what can happen. Ignoring these updates doesn't keep things the same. It usually makes things worse. If you miss a renewal, you may drive unknowingly with an expired license. You may face fines or insurance issues. You may trigger reviews after a traffic stop. If you miss medical paperwork deadlines, your license can be suspended automatically. Appeals take time. Reinstatement can be costly. And once a license is suspended, even temporarily, getting coverage back from insurance companies is not always easy. So the price of ignoring DMV mail or delaying appointments can be much higher than people expect. This is not meant to scare you. It's meant to protect you. Because the people who suffer most are not reckless drivers. They're everyday seniors who simply didn't realize the rules had changed. So please treat this as a warning, but also as an opportunity to stay ahead and stay independent. Now let's shift to something more hopeful: how families can support senior drivers. This should not be something seniors face alone. Families need to be part of the solution. Here's how families can help: help track renewal dates, assist with scheduling medical exams, review DMV notices together, plan transportation backups before emergencies. But most importantly, talk about it with respect. This isn't about taking keys away. It's about keeping options open as long as possible. When families work together, seniors are more likely to stay safe, mobile, and emotionally healthy. And that's the goal: not sudden loss of independence, but gradual, supported transitions, if and when they become necessary. Because nobody should feel like their life changed overnight just because of a letter in the mail. Now let's recap the 3 big changes so you leave this video clear and confident. Your freedom should never disappear because you missed a rule change. Your independence should never be taken quietly. If you or someone you love is over 65, this information is not optional. It's protection. Please share this video with your parents, your grandparents, and anyone who depends on driving to live their life. And if you want to stay ahead of changes that affect your money, your benefits, and your daily survival, make sure you're subscribed and watching future updates, because the system moves fast. But together, we can move smarter. Stay informed, stay prepared, and most importantly, stay in control of your future. This is not just news. This is your life, and it matters.